afternoon, everybody. I'm Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Friday, April the 3rd. I'm here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gale, and Dr. Al Wong, our Regional EMS Director. So we continue to see spread of the coronavirus and causing the COVID-19 disease here in Montgomery County. Since our press briefing yesterday, we have 71 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 778 cases, 778. These positive individuals are from 33 municipalities, one of which is reporting their first case, and that is Hatfield Borough with one case. This moves us to 56 of our 62 communities that are home to individuals with COVID-19. Today's individuals range in age from 7 years old to 87 years old, and you can check our county map at montgomery.org/COVID-19 for an updated municipal map. The age brackets today, there are 2 people in the 0 to 9 range, 2 people that are 10 to 19 years old, 15 that are 20 to 29, 7 individuals that are 30 to 39, 10 that are 40 to 49, 18 that are 50 to 59, 11 that are 60 to 69, 4 that are 70 to 79, and 2 that are 80 to 89. There are 37 females, 31 males, 3 that are unknown. There are 3 individuals that are hospitalized, one that is at home in isolation, and 67 that are unknown at this time. I'm saddened to confirm that there are 3 more Montgomery County residents that have lost their lives to COVID-19, which brings us to a total of 15 deaths since this began. The first individual was an 87-year-old female from Upper Gwynedd Township. The second was a 94-year-old female from Springfield Township. The third is a 73-year-old male from Abington Township. All passed away while in a hospital, and that's all the information that I have about these 3 individuals. Our community-based testing site is up and running today. Thank you again to Temple Ambler, the Temple University Police, Upper Dublin Township, and the Pennsylvania National Guard Medical Unit, and the many county departments that are assisting in this work. As of April the 1st, we have tested 3,149 individuals. We have 62% of those test results back. And I just want to remind everyone that we only get the results back from the residents of Montgomery County. This is a regional testing site, so we will never get 100% of the results back, because if you live in Bucks or Philly or Chester or Delco, those results will go there. We are running now, 17% of the individuals that we have tested are positive. I want to announce that the site will be closed tomorrow, Saturday, April the 4th. The site will be closed for a safety stand down. What that entails is that we have some new National Guard members coming in, and some of the ones that have been here are going out. So they're closing just for the purposes to do that exchange of personnel, make sure everybody's trained up, and the site will reopen on Sunday morning. Registration for Sunday morning will open on Sunday morning at 8 a.m., either online at www.montgomery.org/COVID-19 under the button that says County Testing Information, or starting at 8 a.m. on Sunday morning, you can call 610-631-3000. 610-631-3000. Just a reminder, if you get a busy signal, just wait 5-10 minutes and call back, and please do not call 911 for a testing appointment. We want to keep those lines open for emergencies. I'm very happy to announce today that our county's request for a SEPA Smart Team has been granted. What that means is that we will have a shared regional and state asset of a trained multidisciplinary team and equipment here in Montgomery County. This will enable our medical surge plan to be realized. This SMART team, which stands for Specialized Medical Assistance and Response Team, consists of over 500 volunteer healthcare and support providers. This site will be capable of caring for approximately 50 patients, with some ability to provide critical care for patients that might need that. We want to thank Dr. Thomas Grace, who is the team leader, and we will confirm the location once that is finalized. We're still working on some of those details. But we anticipate that this unit will be arriving hopefully on Sunday. So we're extremely pleased about that. We've been working on this for a while, and this should greatly enhance our surge capacity here in Montgomery County. I also want to give an update on Make Masks for Montco, PA. This is our community Facebook page, and again, you can find it at Make Masks with an S, the number 4, Montco, PA on Facebook. This group started Saturday, March the 28th. There are right now 353 members of this group. Some make masks, some are looking for masks, some are just helping to promote and share the group. We've had over 1,400 posts, comments, and reactions in just the 6 days that it's been up. And approximately 1,100 masks have been made and shared on this Facebook page. So we're really happy that this has gained some traction very, very quickly. Anyone can join this group. It's a public group. And we are looking for people who are making masks, and they can post that they have some number of masks available for the community. And then certainly any individuals or organizations that need masks can also put a request up for what they're looking for and how many masks they would like to get if possible. We've had a number of organizations request masks. Just to give you a sense, the ones that are in Montgomery County include Abington Lansdale Hospital, Abington Hospital, the Daily Food Pantry in Collegeville, lots of different healthcare providers, nursing homes, Penn Foundation, police and fire departments, Pottstown Medical Specialists, and SCI Phoenix, some senior living communities, including St. Joseph's Villa, and the Open Link, which does a lot of our Meals on Wheels deliveries. We've also had requests from outside of Montgomery County, including Temple Hospital, CHOP, Chestnut Hill Hospital, and SCI Chester. So the need is there, absolutely. So if you're able to help make masks, there's all kinds of great information on the site about mask patterns and materials and things like that. So feel free to hop on that site if you are able and help our community out with that. So I want to give everyone an update on our social distancing efforts here in Montgomery County. And today I want to just remind everyone to take a step back. And that is my way of reminding people, if you're out walking and you come upon somebody or you run into a neighbor and they start to talk with you, everyone's natural tendency is to step toward the person that they're talking to. We do it really unconsciously, but I want to encourage all of you today to be the one to take a step back instead. And I promise you, everybody sort of jumps for a second when you do that. But when you take that step back, they'll take that step back too. And then you'll probably be 6 feet apart, just like you need to be to prevent the spread of the coronavirus. So take a step back. Be the one that takes that step back. Don't be embarrassed, be proud. Be proud that you are helping to keep our community safe by practicing social distancing. So today I have a new map for you. This one is at cubic.com. That's spelled cubiq.com. And this is another cell phone tracking app. I don't know how it works, so don't be mad at me if someone's tracking your cell phone. But that star is us, Montgomery County, and we are, of the counties in our region, we have the lowest mobility index, which means we have the least amount of people moving around. So this is great. Chester County is almost as good as we are. We have a little bit of competition with Chester County. We are slightly ahead of them. But this is great. Like, this is where we want to be. And the more we can be in this place with the least amount of mobility possible, the faster we're going to get through this here in Montgomery County, the lower that surge is going to be that our hospitals and our first responders are going to have to face. Remember, the goal here is to keep the people that have to go to work safe. The people at your grocery store, the people at your pharmacy, our first responders. We want to make sure whether you're sick from COVID-19 or you're having a heart attack, that there will be a first responder who can come and get you quickly, and that there will be a hospital bed waiting for you on the other end of that trip. Right now, all of our hospitals do have open beds, including in their ICUs. But every day, those open beds get a little fewer. And our goal here with asking everyone to stay home is to making sure that we get through this with enough beds, with enough first responders. We are thrilled that we have this surge capacity now coming to our county, but it is surge capacity for our region. So it is an asset that will be shared by our neighbors as well. So the goal is to just keep those numbers as low as possible. I love to see things like this because I know how hard this is. But that means that people in our region are doing a good job, but we cannot let up. The time is not yet to let up. As we go into this weekend, I know it doesn't really seem like the weekend. Every day is kind of the same now, but don't let up this weekend. Do not let your kids go out and play basketball. Do not plan some gathering with your friends. It's too soon for that. Please, please stay home. And with that, I will turn over to Commissioner Lawrence.
As we're in the time for that. So it's always a great event. I wore my blue today. I want to thank MCAP for all that they do, and next year we'll be back in blue on the courthouse steps. I also want to announce Montco Strong. The Montco Strong Small Business Gift Network is a collaboration between the 15 chambers of commerce that serve Montgomery County, along with the Montgomery County LGBT Business Council and the Valley Forge Tourism and Convention Board, in partnership with the Montgomery County Commerce Department. Through the county's COVID-19 data hub, businesses can sign up to connect with people with their gift card options, and anyone can go online to find great opportunities to support Montco businesses by buying a gift card or 2 or 3. And this is just one of the ways that we're trying to support our small businesses during this crisis. Each business that participates will provide all the information on how consumers can purchase their gift cards. So if you are a business that would like to sign up for this, you can please visit www.montcopa.org/COVID-19 and look under the Find My Topic button to find the link for businesses. And if you are someone who's looking to support a small business in Montgomery County, you can go there this weekend as well to purchase a card. We do want to note that due to staff capacity and all the information, we'll be putting on about 30 businesses a day. So if you sign up, you might not be on tomorrow, but we will make sure that we get as many of our small businesses on there as possible. And we encourage people to purchase gift cards. And once we can all go out and shop again, you can use them. And with that, I'll turn it over to Commissioner Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. For the many firearm owners in Montgomery County and across the Commonwealth of Pennsylvania, I have some good news. Although Governor Wolf's original business closure order deemed gun shops as non-essential, last week he revised his order to allow firearm dealers to sell by individual appointment. In addition, the state of Pennsylvania has granted an extension for license to carry permits. Permits expired March 19th, 2020 or later have been extended to May 30th, 2020. This extension is necessary due to the closure of some county courthouses and sheriff offices across the Commonwealth. On March 16th, 2020, Montgomery County Sheriff Sean Kilkenny suspended the processing of gun permits. Furthermore, Sheriff Kilkenny has temporarily suspended new gun permit applications. Once things return to normal, the Montgomery County Sheriff's Office may extend service hours, including Saturdays, to stem the backlog of gun permit applications. In closing, I want to thank all of you listening and watching at home, and I want you to know that I'm a supporter of the Second Amendment and will continue to be a champion of your right to bear arms. Thank you very much, and I'll turn it back to Commissioner Arkush.
All right, I will be happy to take your questions.
Understanding you can't say a lot about it, but kind of what does the surge capacity facility, what does that look like? What does it kind of entail?
So some of those details are still being worked out. It is likely going to end up being partly within a facility and partly a tent. So we're still ironing all that out. That's why I'm not 100% sure that I know exactly where it's going to be yet. So well, as soon as we have photos and more details, we'll share them with you.
I heard today that there may be concerns that there are hospitals in Philadelphia and the region that are seeing patients come down from New York and North Jersey. Are we seeing that here? Is that a concern? Is there any way to kind of...
I've heard that anecdotally from Philly hospitals. I have not heard that directly from any of our hospitals here. But it wouldn't surprise me, but there's really nothing we can do about that.
So that's just part of
Yeah,
the world, and that's just the way it is.
yeah.
The governor today called for universal masking. Are you concerned that it will encourage people to gather?
So masks are not magical, and I think that is a really important point here. Masks are most useful, and when we talk about masks, we're talking about just ones that we can make at home. They're most useful for people that are actually sick and coughing or sneezing and could spread the coronavirus through those respiratory droplets. The cloth masks can help contain someone's cough if they cough into the mask, but they're not magical. They're not like the N95 masks that our medical personnel can wear, and they will not completely prevent the virus going through that mask. So it's really important that people not think that wearing a cloth mask does anything more than slightly reduce their risk of catching this virus. It will slightly reduce the risk, but it's not magical. So the most important thing you can do is stay at home and limit the number of trips that you make. I'm going to save all the parents a lot of drama here. No, your kids cannot play basketball if they're wearing masks. No, your kids cannot do any other activity with their friends that aren't their household contacts just because they have on a mask. They are not magical, and they will provide a small amount of protection, but no one should get any false sense of security that just because they have a mask on, they can go back to whatever they were doing before this started. The most important thing people can do is stay home.
Also, I noted that you were saying that you have 17% cases are positive, and that's been an increase. Are you concerned at all about that percentage going up?
So we'll see what the next few days bring. As we discussed here many, many times, we are anticipating that the number of cases is bound to go up sometime in these next couple of weeks. We have had single days previously where we had 17%, but then the next couple days it would sort of average out to something lower. So one day does not a trend make, and we'll see what it looks like over the next few days. But we're particularly happy that we've got some additional surge capacity coming here to the county, and we do anticipate that those numbers will go up to some degree. The whole point is we want to try to keep that as low as possible. I mentioned, I think a couple days ago, that in New York, for instance, just to put this in some context, there's neighborhoods in New York City where anywhere from 35%, maybe even higher, of the people that are tested are positive. So we're still much, much, much lower than that, and hopefully are going to stay pretty much in that range.
And the hospital that's gonna be for the surge protection, is that gonna see COVID-19 cases or other, are you looking to put other cases there?
We're still working out those details. So as soon as we have that finalized, we will definitely make that clear to the public.
Any movement with Exelon,
Could you be more specific?
with the Limerick? Is there any communications, have communications improved, have they,
So the question is, are we in more or different or better communication with Exelon? We are in communication with them on a daily basis. Our Office of Public Health is working to establish a routine set of data that will come to us each day and is giving some guidance to their folks on what data they should be collecting, what they should be doing. I will tell you that I have received, both in my public email and then here at our Public Safety Center, we've received calls, about 6, 7 of them, calls and emails from individuals who have some concerns about what's going on at the site. I've communicated that to my primary contact at Exelon and asked for an update about what the actual conditions are at the site, and I have not heard back yet.
is there any word, I know one of the questions has been, if people are sent home, quarantined, isolated, whatever it may be, would they be paid? Is there any?
The question is, if people are sent home or quarantined, would they be paid? You'll have to ask Exelon about that.
Just kind of piggybacking off that, in terms of, one of the concerns was that they, after this job, they would go to the next job and it would keep spreading. Are they gonna be able to quarantine the folks they have here before they go to the next job?
So the question is, when the folks that leave here before they go to the next job, will they be quarantined? I have asked Exelon to put some process like that into place. I think that out of respect for the families of these workers and the home communities of these workers, or if the plan was for them to go directly to another refueling job, wherever they're going, they should be put into quarantine somewhere. I believe those workers should be paid for their time by Exelon before they are released to go either home or to the next refueling site. I've been clear about that publicly and with the Exelon folks, and only Exelon can answer that question. But I urge you to ask them that question. Got anything from?
No additional questions.
Okay. All right.
Modeling still looking the same as far as mid-April?
Seems like it, yeah. The question was, does the modeling still look the same? It does still look to be, mid-April, yeah, for the peak. All right, great, thanks everybody. Oh, we will not do live over the weekend. We're not planning to do live over the weekend. We will issue a press release both tomorrow and Sunday, and plan to be back here Monday at 3 p.m. Thank you.